a stranger with a gun came upon two teens taking pictures under a rising full moon. But violence is only the beginning of this story.
Sometimes I thought, there are no miracles. Yeah, there are, and this is a big one.
I'm Amy Donaldson, and I've spent my career talking about how lives are undone by violence. The Letter is a podcast about how lives are remade. Follow The Letter at theletterpodcast.com or wherever you get your podcasts.
In today's episode of Project Recovery,
when you think about going to the doctor, you pick a specialist, right? And so everybody has a different specialty. People don't realize that's the same with therapists.
make sure you listen to the end. Find us on Facebook at Project Recovery. We'll have that and much more coming up. Hey, welcome to Project Recovery, a podcast about addiction. More importantly, it's about recovery, brought to you by our friends at useonlyasdirected.org. They got a three-part solution to help you out, Dr. Matt. That is speak out, opt out, and, of course, throw out. They're flipping the script, and they're changing the narrative. They're going to go to know your script, and that is beneficial. Why?
Because it works on two levels, right?
Lay them on me.
So the first level is your script, meaning a prescription. What is it?
Yeah.
What are you taking? Are you educating yourself? Do you Google it at least, or talk to your doctor more specifically about it? Number two is the script of how to talk to your doctor. Right?
The narrative.
The narrative. How do I have a conversation? A lot of us, I think, were raised with just saying yes to the doctor,
Because the doctor told me so.
We do it. Instead of, I think we've used my example a couple of times when my son got his wisdom teeth out, and they had a regular like Percocet type prescription for him to go home with. And to their credit, it was small. But I said, what else could we do instead? We changed it to a less significant opioid for just 2 pills, and then managing the rest with Tylenol and ibuprofen. And if I hadn't brought that up to the doc, we would have just walked out with the regular Percocet script. And so, and they were very cool about it, very happy to talk to me about it. I didn't feel like it was a problem at all. And, they don't know that I work in the medical field. I mean, they
don't know who you are.
The dad, because I showed up looking like this. And,
yeah.
And so, I think that's exactly the right thing. Know your script on both levels, and you'll be fine.
All right, now this week's episode is just going to be Dr. Matt and myself. We're just going to kind of talk a little bit about therapy and therapists because I've got a lot of questions. But before we get to that,
we're putting therapists on trial. Is that what we're doing?
No. We want to find out how to get a good one and how to manage your expectations when seeing one. But speaking of seeing, I don't know if you noticed this.
You got your glasses on, yeah.
I haven't worn glasses for a year. Now, to be honest, I used to wear glasses just to hide the bags underneath my eyes.
See, that's funny because you always had cool glasses when we did TV together back in the day. And I didn't realize that was the reason. But why were your eyes getting baggy?
Well, because I was drinking a lot. I was burning the candle at both ends.
Yeah, you were.
So my mom used to call me, and she'd say, man, your eyes look horrible. Mary Nichols from Channel 2 used to say, hey, are you going on a vacation? Your eyes are packing bags. And, and so they were really, really bad. But these glasses are special, Dr. Matt.
Are they the blue light ones? No? What are they?
Bifocals.
Bifocals.
I know, man.
I'm older than you.
I got bifocals, man.
I'll start calling you Ben Franklin.
Right? So I went to go see.
But they don't look like the regular.
They're called the progressive lens. And so they go from my normal prescription down to a bifocal.
Not like Grandpa's where you could see
No, where you have to put them on the end of your nose like that. Not like that.
Okay.
But so I went and got my eyes checked, and just because I haven't been wearing glasses, and I was getting headaches and stuff. So I got bifocals.
Well, I mean, you don't read, so
not
it's
often,
not that important.
But I like to see what, when I'm watching NCIS, my stories, you know what I mean?
Watching your stories.
I like
you
to
got
see
to be able to see it in crystal clear.
I like to see what Gibbs is up to, and so I do that.
Those are some nice looking glasses. I actually was going to compliment you on.
Thank you very much. But I've got something more important to talk to you about.
Oh, okay.
So 2 weeks ago, I had a cold. A man cold.
A man cold.
A man cold, which is worse than a woman's cold.
Explain.
Well, it's just your body hurts, you're achy, you're irritable. It's a man cold.
Yeah.
I mean, it's a real thing. You can look it up. Google it.
Sure.
So I'd had some hard time sleeping, and I go to the medicine cabinet. Mm-hmm. I open up the medicine cabinet, and I want to get some good sleep because sleep is essential. And so I was going to take some NyQuil.
Mm-hmm.
And NyQuil has what in it?
Alcohol.
It
does.
So I had a 15-minute conversation with myself in front of the medicine cabinet, staring at a bottle of NyQuil.
Yeah.
And it went something like this. Man, I really need to get some sleep. I was up all night coughing.
Right.
I think
Can't be your best self if you're sick and sleep deprived.
Yeah, and so I go to, and I grab the bottle of NyQuil. I pull it down, and I look at it, and I flip it over, and I read the ingredients, and they're bold and print, just popping out of the packaging, alcohol.
Yeah. Yep.
And so I had said to myself, I was like, this is what you're supposed to do.
Right. It's an over-the-counter medication, very common. It's effective.
Yeah.
Help you get to sleep.
And I thought, I think I'm in a good place where I could take it. And it's
2 years.
2 years.
Yeah.
And you know what I mean? And so I sat there, and I had like a devil on one shoulder and an angel on the other shoulder. And they were fighting back and forth. And I was like, but I should be able to do it. But then the white angel goes, hey, do you really want to chance it? Is it worth it? I mean, who knows what could happen?
Right.
Because, when I was in recovery, you weren't allowed to have hand sanitizer. You weren't allowed to have NyQuil.
Cologne
even. Anything with alcohol in it. Why? Just why would you? No need for it.
Yeah.
So I didn't take it. And I don't know how I feel about it because, I feel good about my decision, but it was the first time that I wrestled with it. And my thought process was, if I open this up and I taste it and I like it, what have I done? Why even invite that into my life? Why even?
That's smart.
So I just didn't get good sleep that night.
And was it worth it?
Yeah, because right now I'm here to tell you the story, and I'm alive, and I don't have to mess with that. But I want to just put a little point on it. That's how easily it could sneak back into my life.
Yeah.
You know what I mean? And do I think right now, looking at the camera, do I think I could have done it? Yeah. But why? Why chance it? Why even take the chance?
Why go there?
Why? If I wasn't dying, I just had a restless night of sleep. And so then I went and got some NyQuil that didn't have the alcohol in it.
Yeah, you can get, I was going to say there are other options that are also very effective without that. But you're right. It's sort of, it's one of those moments where, well, I'm glad you've shared it because I've had several of our listeners ask me, like, it doesn't seem like Casey's really had that hard of a time staying sober for the last 2 years. Like, he doesn't talk about that very much. So I think it's good for the listeners to know that I think, and we're going to talk later maybe why your, recovery has been very successful. But this is a good example of one of those. I like the cartoons with the devil and the angel on your shoulders, and when you get in those moments in life, it really feels like that.
Oh, and it did because I started to question my manhood. Like, what? You can have this.
It's just NyQuil. You've been taking that since you were a kid, right?
You used to drink tequila straight out of the bottle. You know what I mean? This is just a cap full of the green stuff. You'll be all right. And I was like, but why? Yeah. But why even invite it into my life? Everything seems to be going so wonderful.
Yeah.
And so why even just... Well,
but the devil part of that is, but you need it. It has medicine in it. You're not feeling well.
Quit being a wussy, Casey. Take it. This is what it's made for.
And I think going back to, we started off talking about our sponsors program of throwing out opioids and how addictive those are. We've had so many stories. But that's another one where a person comes home from like a surgery and they know they have a problem with opioids, but maybe they have the prescription. Oh, I should take them like prescribed. There's always a reason that pops up eventually, and you have to deal with that. Should I not? And I think it's always better to err on the side of caution and not, like you said, introduce that back into your life in any form if you can help it.
And so it was me knowing my limits and knowing what I was okay with. And the fact that I was having that conversation right there let me know that I wasn't okay with it.
Yeah. Yeah, that's a good point. If you have to debate it, you're not okay with it.
Yeah. And so I was trying to talk myself into it or out of it, and luckily I talked myself out of it, and I feel good about the situation.
Good.
I've had a lot of people ask me about my sobriety and about my recovery, and, they go, you haven't done anything? And I can tell you with my hand on a Bible, one hand up to God, I haven't done anything.
Not even NyQuil.
Not even NyQuil. Since September 3rd. I've got 2 years plus counting, and I don't see any future of me doing it. But it was kind of crazy to how all of a sudden that just happened. And I was like, whoa, I can't even believe I'm having this conversation.
Yeah.
But I'm glad I did.
And just so you know, when people say it doesn't seem like he's had a hard time, I've said, well, you're just listening to him on the podcast. I mean, it's been a struggle for 2 years.
Oh, yeah,
I don't want people to get the wrong idea. But I'm glad you shared that as an example, because that's different than just, like being tempted because you're at a party or something. You had a reason to consider it.
It's easy not to at a party.
You have an excuse just right there waiting in the cabinet.
Yeah. So, hey, you're listening to Project Recovery. Coming up, we're going to talk about therapists and therapy, what to expect, how to find a good one, and all the good stuff. Hey, welcome back to Project Recovery, a podcast about addiction, more importantly, about recovery. Dr. Matt, I was on the Facebook, and I was scrolling.
The Facebook.
The Facebook, and they said there's a new game. It's every morning you wake up to see what's next. Like yesterday was Eddie Van Halen.
Oh,
I mean,
I know.
2020, the hits just keep coming, man.
They do.
And you just go,
That's
what?
not a game I want to play, though.
No, it's not fun, but that's the reality that we live in right now. And I don't know if it's more prevalent because of social media and TV, and we're more heightened to it.
It for sure is, but that being said,
2020 is one for the record books.
It really is.
And so I've been, believe it or not, we spend a lot of time on our Facebook and our social and when we interact with people out and about. And a lot of people have come up to me and wanting to talk to therapists or get recommendations for therapists. And, you're my go-to guy. And so I always go, well, let me see what I can do. And I send a text to you and you tell me some therapists that are in this area or what to do. But I know therapists are overworked right now, and there's a big wait list to get into a good one. Why is that?
I think there's a lot of reasons. First of all, we have a higher demand. People are aware that going to therapy might be more helpful to them this year, I think, than in past years. People are. It's not just an individual problem, but it's like the whole society. People are stuck at home. I don't think very many people realized how hard that would be on them. And then there just aren't that many therapists, to be honest with you. Mental health, whether it's, MDs like psychiatrists, PhDs like psychologists, or social work therapists, they're always a little bit overworked. There aren't enough people in mental health, and the more society realizes they can benefit from mental health care, I think the more we're getting overwhelmed with calls and wait lists. And yeah, it's just that there just aren't as many providers.
All right, now you brought something up to me, because when people call and they ask me and they go, hey, do you have a therapist recommendation for me? And I call you. You said there was, just right there, you broke down 3 different kind of therapists.
Yeah.
And so, when I'm looking for a loved one or looking to help somebody, of course, I want to go to the best of the best. And that's probably what you are?
The best of the best? Well,
I mean, like the highest tier of therapist.
Well, education-wise, a doctoral degree is the highest, and that's what I have. I have a doctorate in clinical psychology, but not a medical doctorate. So an MD who goes into mental health care, so they go to medical school and then they do their residency in psychiatry, they become a psychiatrist. And psychiatrists are always the ones that do therapy on TV because they started therapy back with Freud and the psychoanalytic people. But the reality is nowadays a psychiatrist is the one who their primary mode of intervention is medicine. They're medical doctors. It makes sense. They prescribe medicine. Many of them are also very good at what we kind of call short-term focus therapy. So if you went in and their visits are a little bit shorter, typically 30 minutes, maybe an hour, but typically not. And you might spend some time talking about your issues and why you're struggling and what medicines would be helpful for that. And then there would be some therapeutic conversation in there, typically cognitive type of therapy and supportive therapy. So that's what they do. And so a lot of people, I actually had this conversation with a neighbor friend the other day this week about she wanted to see a therapist, and then she said psychiatrist, and I had to explain to her, you probably mean not a psychiatrist, because she's like, oh, yeah, I don't want to do medicine.
See, and I think that's the confusion, and I think the general public all has those same questions. So when you're looking into yourself and you're thinking a therapist might be a good idea, what do you go looking for?
Well, so first of all, you want to look for somebody who's certified in your state as a therapist. In most states, you have a few different types of folks. You might have psychologists who have a doctoral degree in a type of psychology. Mine is clinical psychology, and they're probably the most common therapists, or counseling psychology is another type that's common. There are some other master's level therapists in most states, marriage and family therapists, which technically you can get a PhD in, so don't send me an email. I realize that. But there aren't very many of the PhDs at that level. So a master's degree, a social work in many states are very common, licensed clinical social workers. And then certified mental health counselors, I believe, have a master's degree. I'm not too familiar with their profession. But they all do therapy in under that umbrella of mental health. What you need to pay attention to, I think, is the person I'm going to see certified? A. B, what's their specialty? And that's where I think most people don't understand the difference. When you say therapist, they think everybody has the same training, and they don't. So if you're looking for family therapy, a marriage and family therapist is probably a really good choice because that's their focus.
If you got a substance abuse or...
And so there are substance abuse counselors, and I guess they do a type of therapy as well. And so that's a certificate, so less education, but very focused education, so they can be excellent providers for somebody that's struggling with substance abuse. Sometimes you have therapists that work in tandem. You might have a person seeing a substance abuse counselor as well as a clinical psychologist because they're kind of sharing the load and dividing what the person is working on. But here's the thing. When you think about going to the doctor, medical doctor, you pick a specialist, right? Like after you've been to the orthopedist many times, right?
I got a fake hip.
Yeah, you got the fake hip, and they work on your bones and your joints, right? So, and you take your kids to a pediatrician because that they work with the littles, and your family doctor helps you as your family gets older, and so everybody has a different specialty. People don't realize that's the same with therapists. First of all, our educational background may be different, but also what you focus on. For example, I just started with a new adolescent patient a little while ago, and what the presenting problem was about school refusal, didn't want to go to school. Okay, so I work with teenagers a lot, and we started talking. Turned out pretty quickly within that first visit, I realized this girl has a pretty significant eating disorder. And I am not a specialist in eating disorders, and that is an issue that you really should see a specialist therapist for. And so I've spent the better part of the last week scrambling trying to find somebody that's a good fit. So there are places like Center for Change, where they have, Dr. Nicole Hawkins is a clinical psychologist who specializes in eating disorders, and she's been on our show. And within the University of Utah's healthcare system, we also have specialists that do things. So getting people, sometimes when a person comes in to see me and we discover, it's something specific like that, we want to get them off to a specialist. So you should interview, you need to be a good consumer of your own health care, not just for the medical doctor, because if you have a hip replacement, you don't go to the pediatrician, you go to the orthopedist, right?
Yeah.
But same thing with therapy. Like you need to say, well, what are my presenting problems? Why do I need to go to the therapist? And then I need to find a therapist that does what I need, that they either are certified in that or they are very well experienced and trained in that. And I like to promote psychology, of course, because I'm a psychologist. But to be honest, there are master's level therapists like social workers and others that are very proficient, and I love to refer people to because I know they do such an excellent job working with, postpartum depression, for example. Well, I think you ought to go to probably a female therapist who has a lot of training in that. Could a male therapist work in that? Sure, but I don't. And so when I have that request, I find somebody who specializes in that.
It's interesting that you bring this up because it reminds me of last week's guest. We had Diana on.
Right.
And when I'm talking to Diana, because I do all the booking of our guests on the show, the majority of them anyways, she called me and said she wants to come in and talk about her opioid abuse. And I was like, cool. And I don't find out.
There's the presenting problem. Yeah, that's what we would call it.
I don't find out much more about them because I want to go along the ride with our viewers.
That's our goal, is to make the conversation genuine and real. So
so when questions arise, they're genuine questions, they're honest reactions. And so we're all kind of hearing their story and experiencing it at the same time. So I said, like, come on in and let's talk about, your opioid addiction. And when we got into that, it didn't start with an opioid addiction. It actually started with bulimia probably 20 years prior. And It was interesting to see your wheels turn and kind of navigate that conversation, because it seemed like what you came in for was probably a result of things that had been in the making in the past.
For sure. Yeah, that was an interesting case, I guess, episode. Because we've had a few like that where they came in with a presenting problem, which is genuine. But the reality is other things were more significant in starting the ending problem. Like in her case, it got a little confusing, and I started asking questions, and so did you. And we realized, going way back to her early adolescence, she'd had a traumatic event by being made fun of. Shamed, yeah. And that kicked off, I think she said, 18 years of bulimia. And that bulimic behavior also shaped a lot of other things in her life, including negatively affecting her health. And then she also, we found, over those years had developed a lot of codependency in her relationships. And I mean, the codependency significantly impacted her willingness, I suppose, to take opioids. And people can go back and listen to the episode. But being codependent on a partner, and then having a partner who was an alcoholic, and then a partner who was basically pushing opioids on her, she wasn't just dealing with an opioid addiction. She was dealing with all the problems that come with your self-concept if you're bulimic, as well as this dealing with trying to break a codependent relationship. And I mean, that's a lot heavier and more complicated than just struggling with an opioid addiction.
And I think and I said it on our Facebook post that I posted yesterday, was that, a lot of people come in for an addiction. And we've said this often on the podcast, that the addiction is the result or the solution to problems you have. Okay?
Yeah.
And a lot of times that is.
Yeah. They stem from those problems.
And so if you don't go back and fix those problems, or address those problems, the likelihood of relapse or your life not improving is significant.
Very significant. In fact, that's we call in hospital lingo, we call it recidivism. And in mental health care, every state has a state mental health hospital where people who are at the most severe, they have to go and stay for a period of time, and then they go back. Well, they noticed over the years that patients were going to this hospital, which is nice and therapeutic, and medications, and and we have one here in Provo. It's a beautiful grounds, and they were getting better, and then they would go home, and then within a few weeks or months they would need to come back. And so they finally decided, well, maybe we should figure out what's going on at their home. And what was happening was we were plucking these people out of these very chaotic situations, putting them in a contrived, therapeutic, controlled situation, and then sending them back to the chaos, right? And I think the question is, well, whose responsibility is it where, and all of that? And that's where, frankly, good outpatient therapists and social workers play a huge role in helping people change what they're going back to. But the principle is the same with substance abuse. I think we have so many people relapsing because life is really hard, or they may have pre-existing mental health conditions, and they get sober, but then those other things aren't addressed.
Yeah.
And so then the alcohol or the drugs that they were using to try to deal with the emotional pain and difficulties of those other things becomes really tempting again.
And once again, it goes to, those dumb sayings that I heard in recovery that I used to think were dumb, but now they really make sense. If nothing changes, nothing changes.
Right.
And so you can get sober, but you still have those problems, and you still have those feelings, you still have anxiety, you have those emotions. If we don't give you the proper tools to deal with those, the chance of relapsing is great.
Oh, huge.
And so that's what's so fascinating about this podcast is often when people come in with one thing after talking with you and sharing their story, and often saying it for the first time aloud, who many of our guests have, they realize, I
got other stuff going on.
Yeah. I can, when you take it back, and with the sober head, you can look back at it. People will say to me all the time, he goes, well, I didn't know the addiction was that bad. Well, it wasn't that bad in the beginning, but was the addiction there? Yeah, it was there. I just managed it better, and it hadn't taken control of my life, but it was always there. I can look back over 20 years and tell you, boom, 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 there it is. There it was. And then I could put it away or kind of stay away from it. And it got really bad towards the end. But I can say for the past 20 years, addiction and alcohol was hand in hand with my life.
So it ebbed and flowed with how good or easy or positive your life was.
Yeah. And, and then it became a crutch, and then it became a mainstay. And then when my life went upside down because of the alcohol increased, and it just got out of control. And that's when I said, I can't do this anymore. I can't fight this fight. I'm not going to outthink this. I'm not smarter than this. I've just got to walk away from it.
But that's hard insight to come by, because we think we are smarter than it and we are tougher than it. Like you said, earlier on the show today, like you were like, well, I'm a tough guy. I can handle taking some NyQuil. And it's like, we do that to ourselves. We kind of put pressure on ourselves to out tough things that we really should approach in a different way.
I've talked to so many people who are right on the cusp of looking into recovery, but I can see the battle that's going in their head. And I say to them plain, I go, you're not going to outthink this.
Yeah.
And I can tell you, because I tried for 20 years.
Yeah.
You are not going to outthink this. I've never met one person who's outthought it.
No, you have to. There's definitely a place for thought, but it's after you do the behavior. So I think in recovery, you have to start with just doing. You have to do the behavior. You have to commit to the behavior of recovery. As you get healthier and more sober, then a good therapist and a therapeutic environment and meditation and all those things can help a person start to then think in the right ways. And that's the therapeutic process. I know some people feel like they'd rather just do it on their own, but the reality is a good therapeutic process helps a person develop insight about themselves. And the more you know yourself, and trust me, you're thinking, oh, I know myself. But no, you don't. None of us really do until you put in the time and effort. If you know something really well in your life, like I always call Josh like a technology media professional, and so are you. Because you guys have studied that and you've done it day in and day out, and you know how to hit your marks, and you know about all this stuff that I don't know about in here, because you put the time in. But we somehow ignore that when it comes to ourselves, right?
Yeah.
Like I went to school for a long time, or the person listening, whatever your job is, you've spent a lot of time, practicing that and learning it and going to school for it, and you're an expert in that now, whatever it is that you do. But why don't we put the same? Why do we just think magically I should know everything about myself?
Because I'm me. I spend all the time in my body. I should know me.
Yeah, exactly.
But you don't until you do that introspection and really figure out why you do what you do.
Yeah.
And that's a weird thing to figure out. It's like, oh, that's why I do that.
Oh, yeah. Most of us don't take the time. And some of the ways of learning insight about ourselves may not be that efficient. That's why it's good to visit with somebody who is a professional in helping you learn insight about yourself.
I was talking to somebody on the way in, and he was talking to me because his daughter wants to become a therapist, and he wanted me to ask you some of these questions that I'm asking you, the difference about that. And he goes, what did you like about therapy? And I said, I like talking to somebody who had no skin in the game of what I was doing and just let me talk. And I was like, does that make me weird? And he's like, well, no, let's explore why you think this. And it's because when I talk to my girlfriend or I talk to my mom, they've got certain bias. They
have a relationship with you that depends on you doing certain things for them, and
I've got
versa.
a track record with them where they can make their beliefs on. They go, well, you've said this to me before, and I fell for it, and you burned me. And so here you are again, and I'm cautious, and I got my guard up because I don't want to get burned again.
Yeah.
And so to be able to talk to somebody who doesn't know me yet and really get inside of why I think and why I do what I do is very beneficial.
And I think the process, a lot of people don't understand of therapy, because the only process of therapy that most people know is through TV and movies.
Laying on a couch and having some guy scribble on a paper.
Yeah, which honestly doesn't happen unless, you're going to a psychoanalyst, which is a totally different type of therapy, and there aren't a lot of those around, and I wouldn't even waste your time. But, what I mean by that is 4 or 5 times a week for several $100s a pop and for years. And so it's not really
I'm sure there's a place for it, but yeah.
Yeah, maybe. But if you live in New York, that's the place for it. But one of the things that I think we've talked about before is, my research in the past has been heavily about personality disorders, and a personality is basically kind of like, from a therapist point of view, is sort of like playing detective. If I can understand this person's personality and, more importantly, help them understand their personality, then we're discovering things that help us make change, right? And more importantly, the person, him or herself, if I can help them deepen their understanding of their own personality traits, strengths, weaknesses, however you want to think of it, then they can use that information. Eventually, they don't need me anymore, right? And that's another fear a lot of people have, is that you have to go to a therapist forever or something. And actually, no, I would say more than likely you can have long-term relationships with therapists, but you should start to feel like you're learning things about yourself. That's empowering. You can use that power to make positive changes in your life. And one of them we talked about off air today with you, which is a personality trait. Do you remember what I said? You're a whatever.
All or nothing.
All or nothing personality.
I think you said balls out.
I might have, but not on the show.
Yeah, no.
I would say all or nothing.
Yeah.
And so give the listeners an example of what I meant. Like, and you knew this about yourself, but like, you have this all or nothing personality, and until you put labels on it and understand it, sometimes we just do what we do, right?
So probably 7 years ago, I went on a straight keto diet, and I didn't eat bread for 2 years, and I probably got in the best shape, and I stayed on this diet religiously.
Yeah.
But one day, I introduced a piece of bread, and it was all downhill from there. But that's how it is, and that's how it is with my recovery. And so I got into the gym. The first day that I was in recovery, up at Pinnacle Recovery Center, I went to the gym, and I have been to the gym every day, at least 6 days a week, since September 10th. And I'm just
wow, it's at least 6 days a week. That's
at least
impressive.
6 days a week. I'm an all or nothing kind of guy. And that goes back to the thing we talked about in first with that alcohol and the NyQuil. I didn't want to introduce that to myself.
That's that piece of bread, maybe.
There's these damn things at the Costco, and they're these dark chocolate-covered acai berries, and I absolutely love these.
Those are good.
They're amazing, and I would buy a bag and go, I'm just going to ration these, and I'm not going to eat them all at once. And I'd put them in the fridge, and I'd put them in the kitchen, and I found myself inventing reasons to go in the kitchen. And then I would go into the kitchen. I go, I don't even know why I'm here. Might as well have a handful.
Yeah.
You know what I mean? And so I would trick myself all the time. Yeah. And I'm smart enough to know that I'm tricking myself, but I'm also dumb enough to accept it. I was like, okay, might as well be here.
Might as well.
You can call my girlfriend Leslie. If she puts M&Ms on the countertop,
they're gone, huh?
But if they're out of sight, out of mind.
Right.
But if they're right there, I can't stop myself.
Well, I think that's a wonderful insight that you have about yourself. We've had lots and lots of guests on this program who are all or nothing personalities, right?
Yeah.
You're either all in, but once you kind of flub up a little bit, you're all out.
Yeah. Once there's a kink in the armor, chink. Is it kink or chink?
I would say chink.
Yeah.
Kink something else.
Yeah, if there's a chink in the armor, then the armor just falls for me.
Yeah,
you know. And but see,
by knowing that about yourself, you can see how being all in is so beneficial to you, and why you need to be guarded about those little chinks in your armor, because you've been an all in personality with your profession.
Yeah,
right, and you've had a lot of success from an early age with your profession, and then that helps you in that way, but you're all in with your recovery right now. You've got to take that same attitude that the minute I let my guard down, I could be all out.
Yeah. But see, I just realized this. I knew this about myself my whole life, but I really just put it into thought and was able to utilize it in the last 2 years in my recovery and go, okay, this dictates what I do. I've got to have a better understanding of this. I mean, I could look back and say, yeah, I knew that about myself, but I didn't really know how it affected me.
Yeah. And
does that make sense?
Yeah, that's the difference between just living with yourself and studying yourself.
And it wasn't until I got sober and went back and I can look over the 20 years of my career and go, yep, there. And I can tell you when it started to go down. There.
But when you're going through that process, if you don't have that deeper understanding, then you don't feel empowered to make changes. It's only in retrospect that you look at those things and go, oh, dang, I see where I made those mistakes.
So just to let you know about the gym, I do force myself not to go one day a week and deal with that. And it kills me. I mean, it really does. I go, I should go. I'm not doing anything. I should go. I go, don't go.
Yeah.
Because I don't want to make that.
You don't want to get because exercise for people who are in that all or nothing personality style, exercise can actually wreck their body.
But I've also got to know how to deal with not getting what I want.
Yeah, learning to be moderate.
Yeah, and go okay. And I do it with golf. I go, I can't go.
I know,
and I try, and my addict brain will think of any which way to get me out on that course. And sometimes I just go, I can't.
Yeah.
And it sucks.
The problem is you're always turning me down because you're always got other golfing going on.
I want to golf with you, but I've got so much golf going on that if I call my girlfriend, I go, I got to go with Dr. Matt. He's my co-host. And she goes, oh, you're just looking for another excuse to golf.
Yeah.
But it is what it is.
Yeah, I'll support you in it, man.
I love you, buddy. You're listening to Project Recovery. We'll be right back. Hey, welcome back to my personal therapy session with Dr. Matt. We also call it Project Recovery. I really do enjoy these conversations because I find a little bit more about myself. We get to know a little bit more about you. But I want to bring it back once again to if people are looking for a therapist or a counselor. And see, I've been doing this podcast with you for over a year now, almost 2 years, right?
Going on.
And the first time that it clicked to me is that sometimes you don't need a therapist. Sometimes a counselor can work for you. Is that correct?
Yeah, I mean, those words are used so interchangeably. What I would suggest a person does is the following. If you feel like you need some help and support in your life on anything, take a minute and do your own analysis just for a moment with a piece of paper and a pencil and write down, or use your phone if you like, but write down, what is it that I would like to change? What in my life, about myself, about my relationships, and you might make a little list because most of us can, right? Things that we would like to see improve or be better. When I feel like I need help and support, what am I thinking about? Now, the reason I say that is things ping around in our heads. And until we get them out of our head, we don't really understand them very well. That's one of the values in talking about those things to someone else, like a therapist or sometimes a best friend.
It becomes real when you say it out loud.
It becomes real. And when you write it down, it becomes real. And the way it becomes real, that's not just a platitude. It becomes real because you process it through different neural channels in your brain. You see it, you hear it, you speak it, not just think it. And that it takes on different meanings, and you can develop some insights. Then I would take that list and I would say, okay, what sort of professional person could help me with these sorts of things? If it's a physical health thing, maybe you should start with a nutritionist and work with somebody who can help you with exercise and nutrition. If it's a relationship issue, maybe you've been in your marriage for a long time and it's not what you hoped it would be, and the two of you feel a lot of dissatisfaction or have a lot of conflict. You might say to yourself, okay, now it's clear to me I need to find a counselor or therapist who specializes in marriage issues, right? I don't want to just go to any old therapist. I want to find somebody that has a specialty in that area. Or if it's anxiety, if you feel like, I'm just anxious all the time and I'm living my best life in COVID because I can avoid everybody and I have a good excuse, but I know that anxiety is holding me back from living a good life. And so you might want to work with somebody who specializes in helping you with anxiety. And they can have some answers for you, right? Like when a person comes in to talk to me, especially about anxiety, which is one of my specialties, we might talk about how anxiety is both biological and learned. No. It's absolutely both. That's why anxiety is such a bugger to work on, because it's always biological and it's always learned, and those two play off each other. So sometimes you do need a medication to help for a little bit or for a long time as you learn to retrain patterns of thinking and behavior. So the specialist can have the answers for you, but you need to start with some insight about what am I looking for, right?
But I think you've also got to be honest with yourself when you're making that list.
Yes, you do.
And I think that, I liken therapy to the gym. You're going to get in what you put out.
Yeah, I agree.
And there's
you
a
get
lot.
Out what you put in, but either way.
Yeah, I mean, I think chicken or egg, they're both important.
Sure.
But that's really what it is. It's like you can go there. Like I see people every morning at the gym that just go through the motions, and they think just because they're at the gym It's going to happen. And you go, well, wait a minute. You're not doing anything. You're here.
Right.
But what are you doing? And sometimes it takes a trainer or somebody to get them into the right
plan.
Yes.
Right. Like if I just went and stumbled around the gym and did the exercises that looked like I wanted to do.
Yeah.
First of all, I probably wouldn't be there very long. Second of all, it wouldn't really get me results that I want, right? Because I don't know what I'm doing. I'm not an expert there.
But I think we need to manage people's expectations. And so when they go to a therapist, you've got to go there with earnest intentions.
Sure, you have to want to change, right? I mean, I think that's the old joke, like how many therapists does it take to change a light bulb? And, well, only one, but the light bulb has to want to change, right?
Exactly.
It's a dumb joke. It's a dumb joke. But it's true because, it's the same thing with any professional you go to. If you don't do your part, then you're going to get much less of a positive outcome.
But I think there's a lot of people who go into recovery thinking, my ultimate goal is not to use.
Right. And that's an okay first goal.
Yeah.
But I think so people have asked me before, well, isn't it enough just to be sober?
But now you're just even with everybody else.
Yeah, now you're just even with everyone else, but you still might actually not be even with everybody else because you don't really understand and aren't working on maybe some of the reasons why you used. Why was I using? What is it about me? It's interesting to learn things about yourself that started way back when you were younger. We found that out on this past week's episode with Diana, that there were things that happened in her early life that really contributed to her using later on. On a much less clinical level, I can share one about me, and it came from a good thing. I grew up in a household where my parents are very kind and use a lot of what we call passive language. Would you like to have dinner now? That's passive language. Instead of, it's dinner, that's active language. So I grew up in a nice household. People spoke kindly to each other, and it's partly my personality and temperament to be kind of mellow. And so I just didn't realize my whole life I was a passive language user, and that was fine. That makes me very popular with friends, and I'm easygoing until you are a parent. Then it is the biggest backfire of your life. Okay?
Thanks, Mom. Thanks, Dad.
I didn't realize that, because I was a mellow kid, and my mom would say, would you like to clean your room today? And I'm like, well, yeah, I guess, I'll go down and clean my room. But then you have kids of your own, and they're like, no, I don't want to do my homework. I'm like, hey, buddy, I think you may want to do your homework now. No. And you're like, oh, that didn't go the way I thought it would go.
Yeah.
And so I've had to realize that is an issue, goes way back to my early childhood. It's not necessarily bad, but it does not work when I mean sit your butt down, get your homework done. That lawn isn't going to mow itself. You need to get out there and do it. You're not leaving until the trash is taken out. Like, if I can't learn how to speak directly to the kids, and they just walk all over you. And I think there are a lot of parents right now probably laughing because they realize, oh, crap, I do that too, right?
Yeah.
But see, that's just a little thing. It's not clinical. But once I figured that out and have made changes, and to be honest, it's still a daily struggle because I speak in such passive language. I don't as a therapist because it's kind of a different personality.
You got a different hat
That's
on.
my professional person. But at home, it's very easy for me to speak that way. Anyway, people are probably thinking, hey, we're here to talk about, IV drug use. We don't need to hear about Matt's lame story.
No,
but that's an example of once you learn little insights and sometimes big insights, it empowers you to change. And to be honest, it's better at my household when I am direct, when I need to be direct.
I used to sit in the 12-step rooms when I was in recovery. And this guy would stand up or this girl would stand up and she would say, we've heard it on this podcast many a times, I wouldn't wish this disease on anybody, but I'm glad it happened to me. And I used to think that is the stupidest thing I have ever heard. And I can tell you now, 2 years out from my recovery, that because of my addiction, because of what I went through, because of what I've learned, I am a much better person than I've ever been. I put a post on Facebook the other day. Without a doubt, Casey Scott right now is a better person than he has ever been. And I had somebody come up to me and say, hey, we loved the old Casey. And I said, you can still love the old Casey, and that old Casey was good.
The good parts of the old Casey are still there, though, right?
Yeah. And I said, I haven't changed that much. I will still tell a raunchy joke. I will still make you laugh, and I'm do that. I'm just apologizing a whole lot less, and I've got a much clearer head.
Right.
I love who I am. And I can tell you right now, I wouldn't wish this addiction on anybody, but I wouldn't change it for the world.
So how did that happen, though? So that's the question. I think we're talking about therapy today, and we're talking about, should a person look into therapy? If so, how? But that's a great statement. I think that resonates with us. But how? That's as a clinical psychologist, I am constantly asking how and why. So how did that happen? Because honestly, struggling with alcohol, having a motor vehicle accident, losing your license, none of that sounds positive. So how did it happen that you are glad? What was the process that got you to the point where you could say that?
Because I'm a culmination of all my life experiences. I understand people better. I'm more empathetic. I've got a better relationship with my kids, and I couldn't see myself being who I am if that didn't happen to me.
So you are that way now, and I would agree with that. But what things happened post motor vehicle accident that caused you to be that way? Because I don't think it's just being sober that has accomplished those things for you. I think being sober was essential, but I'm driving towards a point here.
Okay, well, I'm going to walk you through it. Because the other day I was driving with my kids, and I was driving past this road that I used to walk on all the time when I didn't have a license. And I lived a charmed life. I never wanted for anything, and anything usually worked out for me.
You grew up in Shadow Valley, man. It doesn't get any better than that.
Yeah, and I was arrogant. I was cocky, and I thought I was above certain things. And I didn't really portray that, but stuff usually just worked out for me, man. And when it didn't, I had to dig deep and find out who I really was. And a lot of that stuff that made me who I was, I still am. But I've got a better appreciation for who I am and what I got to give back. And I love the fact that I get to do this. This is vital to my recovery. I love the people I have met along the way. I cherish the emails and the texts of people who said, hey, I got sober because you could.
That's amazing.
And so I can't tell you one thing that just switched, but I'm grateful and I've got gratitude and I'm happy to be here and life looks so much better.
Yeah, I would agree with that. I don't think one thing did switch. I think you are describing what I would call self-introspection. And I think there are several things that were forced upon you that helped you create that self-introspection. When life is easy, when we are, I think, overly blessed sometimes, or we have the privileges that we have, there is no need to dig deep and try to figure out more about ourselves because what we're doing is working, right?
Yeah.
And your rock bottom forced you to be in some places you never thought you would be, talking in therapy, being in recovery, meditating. Mugshot. All of these have created, so you see the road that you used to walk on. You look at the mugshot. Oh, those are shiver moments, but they are valuable because they deepen, or they have the potential of deepening introspection. You and I both know plenty of people that have those rock bottom. We sit here and listen to them in the studio, and you're like, well, that's got to be the rock bottom. Nope. There was no humbling that happened there.
They kept digging.
But you took advantage of this forced situation of going to therapy, of going to meditation, of talking with other people, and you use that. And I think anybody who is in long-term recovery hopefully is using that to deepen their understanding about themselves, and that's empowering. So you are closer with your friends and family, your children, than you were before because that has helped you deepen those connections. I'll even say, Casey, I've always had fun with you, but you're much more present now as we hang out, even just joking around in the hallway, talking about nonsense or whatever we do. You're more present and grounded in our conversations. In the past, it sort of felt like you always had another place to go.
I was always looking for the funny thing to say. I wasn't being present.
You weren't being present. And so I think if I could put a pitch out there for the listeners, I would say whether you should be in recovery but you're not, whether you're in long-term recovery, or whether you're a family member of somebody who's an addict, or you're just a listener to the show, deepening your understanding of yourself, developing self-introspection, and then knowing how to have those things as tools in your life is invaluable. If you would like to be living a better life than you are today, that's the place to go, is inward. It isn't anything outside of you necessarily, because once you go inward, all the outside stuff gets better that should get better, and the static starts to go away. That isn't all completely done with a therapist, but a therapist is somebody that can really help you in that process. And a good therapist isn't going to take all the credit for it. A good therapist is like a coach, and I tell this to my new clients all the time. It's okay if you think of me more like a coach or a trainer than a doctor. In fact, in some ways, I prefer that, because what we're doing is you're coming to me, I have some expertise, we're going to discover what the issues are together, and then we're going to work on them. But in between our sessions, you're doing all the work, not me. That's like the trainer at the gym. It's like he or she can give you all the tools, but you've got to lift the weights.
Yeah. And
if you'll do that over time, you probably don't need that trainer anymore. And I'm very happy with people that come and see me. After a while, I say, we don't need to visit every week right now. I think we could visit once a month, and then once every 6 months. And then why don't you just come back when you have something you want to talk about? That's so satisfying, because that person is growing on their own through our conversations, and more importantly, through the things they're doing differently between our conversations. So if you're listening and you feel like your life could use an upgrade, then you might consider writing down the list of things that you would like to work on, and then finding a therapist that works in those areas. How do you find a therapist? That can be a little tricky. Other professionals can help you find other professionals. So if you have a good family doctor, ask them. Call up your healthcare provider and ask them for a list of people that do those things: family therapy, anxiety treatment, whatever it is.
Your work might have an EAP.
Yeah, your work might have an EAP. Many of them do, and that's a great place to start. So just don't stay silent. Ask for referrals, talk to friends, and you'll find somebody to work with that can coach and train you along.
Awesome. Hey, thank you very much for stopping by today. You're listening to Project Recovery, brought to you by useonlyasdirected.org. Speak out, opt out, throw out, and don't forget, Project Recovery, that's a KSL podcast.
The contents of this program are for informational purposes only. The program is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician, licensed therapist, or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you've heard on this program. KSL does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned on the program. Reliance on any information provided on the program is solely at your own risk.
2 years ago, Americans watched in horror as a crisis unfolded at the Kabul airport.
She was tear-gassed and beaten.
Images of thousands desperate to escape Taliban oppression filled our news feeds. More than 80,000 Afghans made it to America. But the story didn't end there.
It was very cold. There was no power, no heat.
Who would help our newest neighbors? I'm Andrea Smartin. In Stranger Becomes Neighbor, you'll hear the stories of some remarkable refugees who left their homes and their dreams behind, only to start over from zero.
Their only possession was 3 blankets.
And you'll meet Americans who stepped up to help them.
You want me to come when you deliver your baby.
What can one person do in the face of an international disaster decades in the making? That's Stranger Becomes Neighbor. Find us at kslpodcast.com. Follow us on Apple Podcasts or anywhere else you listen.